Hello, and welcome to another episode of Inspired Healthy Living with Purva. Today, we will talk about one of the less prevalent form of diabetes, which is type 1 diabetes, or even known as insulin dependent diabetes mellitus. According to the National Diabetes Register, which is NDR, there were 2,800 new cases of type 1 diabetes in Australia in 2018, and it was more prevalent in males than in females. To shed some more light and share some latest research on type 1 diabetes mellitus, we have invited Dr. Ashley Ng. Ashley is a diabetic advocate, accredited practicing dietitian, and lecturer at Trobe University. And she is even my primary PhD supervisor. And we are working together on a few research projects. It is an amazing experience to work with her. Ashley has also completed her PhD in the field of mHealth, information and support through mobile devices, and its use in diabetes education in young adults with diabetes during their life transition. So, without further delay, I would like to invite Ashley over today. A very warm welcome, Ashley, today to our session. And thank you so much for accepting the offer to be here with us.
Oh, anytime. More than happy to chat.
Great. Wonderful. And how has life been post-COVID?
Well, I don't know if we're post-COVID. I think we're still very much in the middle of it.
Still in. That's right.
I wish it's post-COVID.
I know. Post sounds good. I swear. I totally agree with you. I know. Great. So before we begin, Ashley, I just really want to know, like, as a dietitian and a researcher in the area of diabetes, what is the most rewarding part of it, of this career, basically? Why this?
I think for me, I went into a career in healthcare to help other people. So when I first started out, I had no idea what I wanted to do, and it just narrowed, different life changes happened, and it just launched me into a career in research in diabetes and nutrition. So I think for me, it's just been really rewarding to work in an area where I feel like I'm making a difference, and I am making baby steps to make those differences within the healthcare system and helping people to navigate that healthcare system and supporting them throughout the way. So I think for me, that's very selfish, but it's very fulfilling in that sense. And I like the fact that every day is a little bit different as a researcher and as a lecturer as well. So, one day I could be teaching, another day I could be doing research, another day I might be talking to you. So it's all very varied and different. And I really enjoy that dynamic aspect of my work.
Great. I think that's really important. That's wonderful. Thanks for that. Now, could you just because you've talked about your research and everything, do you want to share some more information about your PhD topic and what is mainly your research about? What are you working on at this point of time?
Yeah, sure. So my PhD looked at the development of a mobile health support or mobile health platform. So part of this platform was using a website as well as a Facebook peer support group to support young adults with diabetes during life transitions. And so where this all came about was I was diagnosed with diabetes when I was 19. And so navigating the healthcare system at that age as an adult was quite, I wouldn't say traumatic, but it felt traumatic at some points, but it was very challenging to do that without sort of a lot of support and understanding what goes on and without guidance. So I didn't want other people to go through that same experience. So that's where that project really came from, was, in that age and era and in this time and day when we have social media and the internet at our fingertips, jumping online is probably the first thing you would do to try and find out more information about anything. But it's really hard to find that right support for young people with diabetes out there who've just been diagnosed. So I wanted to create this resource that specifically targets young people and navigate those life transitions along the way. So not so much, moving from a pediatric to an adult setting where you go from 18 to, 19 kind of thing, or, you're entering that stage, but more so when you're already past the age of 18 and you're navigating things like going to uni, going out with friends, trying to be independent, traveling and living independently, all those different massive life transitions all has a significant impact on how people manage their diabetes. So it's about wanting to tackle that and say, what you're feeling here is completely normal, and there are other people out there who go through the same things. You're not alone in this, and yes, you might need extra support, and that's okay. And there's plenty of people out there willing to help you. So my PhD was really focused on that and trying to help connect that bridge and connect a lot of these people back into healthcare as well. So particularly for those who have come from who have been diagnosed from a young age, as we know, a lot of people with type 1 have been diagnosed from a quite early on. Some of them disengage from healthcare, particularly during those tumultuous years where they are too busy, they can't afford the time and the cost to go see a specialist. So it's about re-engaging them back into healthcare as well. So it's a bit of multifaceted thing, and it was really great to be able to work on that project because it was a very passionate project of mine. And then stemming from that, now I'm sort of 2 years out of my PhD, and I'm still working with Diabetes Victoria, trying to get ties with other organisations to try and get this peer support program happening, so that we can support young adults better with diabetes throughout Australia. So not just people with type 1, but people with type 2 as well, because they're a very under-recognised group too. So that's where a lot of my research is heading, and it's sort of broadened out to looking more at sort of peer support and social media and how we can actually use that and integrate that into like the normal diabetes management model of care and traditional healthcare. Yeah, exactly.
I think that's the need of the hour, like especially in situations like this, pandemics like this, and everything is under lockdown. It's the only way you can connect with people is via the technology platform. So why not work on it beforehand rather than wait for something like this to happen and then work towards it? So that was really interesting to know. Wonderful, Ashley. Thank you so much for sharing that with us. Now, with type 1 diabetes, as we know that it is, the numbers are definitely low as compared to type 2 diabetes. And not a lot of people are aware about it. So, they're still confused between what is type 1 and type 2 diabetes. So do you want to put some more light and tell us something more in general, like what is type 1 diabetes?
Yeah, sure. So I think when we talk about diabetes, the general statement is that there are three main types of diabetes. You've got gestational diabetes that normally occurs when a woman is pregnant, and that's because of the hormones that happen with the placenta and things like that. And traditionally that disappears after you give birth to the baby and your hormones kind of settle back down. And then you have type 1 diabetes, which is an autoimmune condition. So that means that there's something that's triggered in the body that starts to attack its own beta cells that produce insulin. So without insulin in the body, you actually have a lot of trouble regulating your blood glucose level. So that means, your body can't flush it out. It accumulates in your bloodstream, so your sugars get really high. And at the same time, your body can't use that sugar for energy. So what happens then is that your body starts breaking down fat. And as a byproduct of that, it produces these things called ketone bodies, which then actually changes the pH level in your bloodstream and makes it extremely dangerous for a person. And that's typically how a lot of people with type 1 diabetes get diagnosed, is through what they call diabetic ketoacidosis, which is the ketone levels in your bloodstream is quite high because you've got no insulin, your sugars are really high, you generally feel like rubbish. And that usually warrants, a case in the hospital, in the emergency department, and that's how type 1 diabetes generally gets diagnosed. So it's generally the body sort of attacking itself, and that's what they call an autoimmune condition. And then you have the more broadly known type 2 diabetes, where it's more classified with insulin resistance. So that means that your body is still producing insulin, so your pancreas is still working relatively normally. It's just that your body is not able to use that insulin as efficiently as a person without diabetes. So there's some mechanism there that's inhibiting that, so it's stopping that. So, over time, the pancreas, keeps trying to meet that load of producing insulin to keep up with the body's demands. And over time, we see with a lot of people with type 2 diabetes that it does sort of progress, and then the pancreas ends up to stop producing insulin. So you can end up going onto insulin, which is perfectly normal. And it's interesting because a lot of people think that's where it stops. But really, when we talk about diabetes, if you don't fit quite nicely into that type 1 category and that gestational diabetes category, you're automatically classified as someone living with type 2 diabetes. But what we don't know is that in type 2 diabetes, or in just diabetes in general, there's over 60 different types of diabetes subcategories that's there. So there's so many
60.
different, there's plenty out there.
Oh my God, even I didn't know that. Okay. That's
There's
new.
lots of different variants, lots of different mechanisms there. There's so much we don't really know about the body, and so much we're still discovering. So when people say, oh, you've got type 2 diabetes, you've got type 1 diabetes, it is very much an oversimplification. It's, once we understand what's happening in the body, what mechanisms are going on, that's when we can better target our medical treatment so that we can help to manage diabetes the best we can as well.
Sure, no, great. That's a very important point. Perfect. Thanks for that, Ashley. Now, what are the like you've discussed about how like type 1 diabetes is an autoimmune condition, right? So are there any other possible reasons or that can be prevented, or something that can be done to avoid the onset of type 1 diabetes? Or what are the other possible reasons for developing type 1 diabetes?
That's a really good question. So at the moment, we know that there is no cure for type 1 diabetes, but we also don't really know what triggers it. So there's a lot of research out there that's looking at maybe potentially environmental impacts. We know that when a body goes through a huge virus, it may tend to trigger type 1 diabetes as well. So a lot of it's hereditary too. So with type 1 diabetes, it kind of runs in the family. So if you have someone in the family who has type 1, you're more likely, your child's more likely to get type 1 diabetes too. So it's interesting whether, your body just carries that genetic composition, and then something in the environment triggers that. People aren't really sure yet. With a lot of the research that's happening, they know that type 1 diabetes can happen at a very gradual pace. So it might not be something that happens overnight. And that's what they're trying to identify now, is how do you screen for type 1 diabetes early on so that you don't get diagnosed through a diabetic ketoacidosis episode, where oftentimes you're feeling quite horrible, you have to go to the hospital. Some people end up in a coma, and it's quite a traumatic and scary diagnosis period. So they're trying to find out how they can, identify and screen for type 1 diabetes earlier on. Similarly for type 2, a lot of people think that, you get type 2 because you're fat, you're lazy, you've eaten too much, you haven't looked after yourself. But, the modifiable risk factors, like the sedentary lifestyle, the dietary habits, that's a small but significant component of type 2 diabetes. But the biggest part of type 2 diabetes is actually the hereditary part as well. It's the genetic makeup of a person. So a lot of people misunderstand that. And so this is where a lot of that stigma comes around with type 2 as well, that, if you just eat well, you're fine. So if a person carries that genetic risk, they can be doing everything perfectly, but then they will still end up developing or being diagnosed with type 2 diabetes. So it's not always very clear cut. And, if we knew the solution for it, we would have a cure for it. And this is why a lot of people, with type 2 diabetes, some people who get diagnosed quite early on, or make huge drastic changes to their lifestyle, can reverse their type 2 diabetes. It's not necessarily a cure, because if you go back to the same way you've been eating beforehand, who's to say that, it's all going to come back? So you can change things, but it's not the same for everyone. And this is where you need to be very individualized with your approach, and understand that, you can't just say, we can prevent all type 2 diabetes, we can cure all type 2 diabetes. because it then sets the person up for failure. If a person has a genetic risk there and they're doing everything they possibly can already, then who's to say their body just doesn't need a little bit of extra help, or they have a different type of diabetes that we don't really understand yet. So there's a lot of things happening there too.
True. Now, as you said about genetics, actually, interestingly, my nephew, he was diagnosed with type 1 diabetes when he was 5. And no one in our family even has
Yes.
type 2 diabetes. Can you imagine?
Yes.
I mean, no one, neither in his family or like his father's side or his mother's side, none of them had type 2 also. Type 1 is way beyond. So what do you have to say about that? And then, with that risk, my sister-in-law, she has not even thought of having another child because she feels that could also have, that child could also pass on with be a type 1 diabetic.
Yeah. So that's we hear that so often, that type 1 diabetes could just happen just randomly. We don't know why. And this is why all the research is happening, to try and understand what's going on. Why do some families randomly have a person with type 1, and then families that have a history of type 1, they are more aware of that risk, so perhaps they're already testing quite often and regularly in terms of making sure, because they're aware of it, that their child gets diagnosed or gets tested quite frequently. Any sign of diabetes, straight away they're like, is it type 1 diabetes? It can be quite very, very anxiety provoking. So I can see where she's coming from in terms of feeling quite anxious of that being passed down. But really, we don't know enough about type 1 diabetes and how it works, or why it's triggered, and where it started, to really predict these things. We know that there's a chance, and it's really just like throwing dice on the table. It seems to be passed on more through male genes. So if your dad has type 1 diabetes, you're more likely that the child will get it. We don't know why. So we have no idea. And I know, and I hear people who talk about, my child's got type 1 and I don't want to have any other kids because I don't want to, or look, I have type 1 and I don't want to risk passing that on. And it's a perfectly valid reason to choose not to have kids, perfectly valid reason to say that's it. At the same time, like for me, I have type 1 myself, or I have a variant of type 1, and having children is something that's important to me. And I know that in this day and age, we can manage it really well, and it's not the end of the world. And I think, with what we've come from in terms of medical technology, advances in medicine, it's not the end of the world. We can deal with it. And who's to say I haven't passed on whatever other shitty genes that I may have had? So you just never know. It's such, and I think this is one of the beauties of life, is that you just never know what's going to happen, but you deal with it as it comes along. So sometimes I try not to overthink that, but again, it's really up to that person, what they feel comfortable with. But I know it's very upsetting when people say to me, like, it's very irresponsible for you to have kids because you're going to pass this thing on to them. And I was like, whoa, okay.
That's not acceptable. Exactly. It's individual's choice. I mean,
Exactly.
And there's no guarantee, as I feel that because in their case, it was like nobody had it at all. And it suddenly happened, and he was also diagnosed by when he had this ketoacidosis episode. So he was in the hospital. His sugar levels were way beyond 30 and something, and all that. And little poor boy around 5, and he's been struggling with that since then. Great. Now, in the type 1 diabetes, LADA is another form of diabetes that is there, right? So is it similar, or what is the basic difference between that? I mean, they both are autoimmune. I don't know why, as you told me today, they are 60, so I'm sure there would be something more about it.
So LADA is what we call latent autoimmune diabetes onset in adults. And what that means is that it's more often diagnosed in adults, but at the same time, its presentation is very different in that people often get misdiagnosed with type 2 diabetes instead of LADA. And with LADA, it means that the onset of type 1 diabetes is a lot longer. We don't know how long for. It's not something doctors can predict, but they can give you a time frame. But whatever your body does, we don't know. It's when a person gets diagnosed with type 1, there's always this little honeymoon period, we call it. So that moment of being diagnosed with type 1 and sort of a few months, or usually it's a few months for people with type 1. For LADA, it seems to be able to be extended to even a few years for some people, where their pancreas is still producing insulin. It's not producing a lot of insulin, it's producing a little bit of insulin, but they still require additional medication to help them regulate their blood glucose levels. So it's almost that very gradual onset of type 1 diabetes. So in that sense, management can be a lot trickier because you don't really know how much insulin your body is producing. And I think this is where, my doctor thought that I had LADA for quite some time because my insulin requirements are very, very low. And they said this is quite weird because, you're producing tiny amounts of insulin, but maybe one day it will just go. And once your pancreas stops producing insulin, they start to see those autoimmune bodies being developed. So that means that your body's full of attacking your pancreas at that stage. So it's a very interesting thing that they're really studying now, because they're not entirely sure why some people, this honeymoon period gets extended for such a long time. But eventually, that person's going to use insulin because their pancreas is going to stop producing insulin. And then on the other hand, you've got, that types of diabetes like MODY, which is mature onset of diabetes in the young, where it's attributed to a single gene change. So there's one gene in your body that's just not quite right. And then the result of that is your body can't regulate blood glucose very well. So there's a few different strands that have been identified already. So it's still quite expensive to do all that genetic testing, but you can, that option is available where you can do genetic testing and try and identify, what genes you might have that aligned with that. And I did that as part of a study, and they said that the limitation of that is they only have a certain number of cases with a certain number of genes. And a lot of these studies have been done in Caucasian populations. So for someone, I'm Asian, they don't have a lot of information or data yet, so they can't accurately say you don't have this or you don't have that. So I think that's really fascinating in terms of how big of a role our genetic makeup plays in, the development of these different conditions.
Oh, true, great. I was also very fascinated by when I was studying, and I had a few patients with LADA recently. So I was like, this was also something new for me. I was like, I was intrigued to learn a little bit more about this also because of this. So with type 1 diabetes, like insulin pump or staying on injections. So this is a common doubt or common question of discussion that generally parents and kids and everybody, the caregivers have. What are your thoughts about that?
So there are two types of tools that you can use in your toolkit for diabetes management. So you've got your multiple daily injections. So what that means is that for someone with type 1, you would have your one injection that's your basal insulin. So that insulin provides you with coverage throughout the day, 24 hours or longer. And then every time you eat a carbohydrate containing meal, you would have a different type of insulin, a short-acting insulin that would cover those carbohydrates. So all up, you might have, depending on how often you eat a day, at least 4 injections or, more during this time period. And then you've got your insulin pump, which is actually connected to you. So you kind of insert it, and it's, you have like a site there that's placed there for 3 days, and then you change it every 3 days, and it's continuously infusing insulin to you. So that means that while you're eating, you just pull out insulin pump and you count the number of carbs you've got in your meal, and then it just does its magic. It delivers your insulin. That's it. So there's pros and cons for both. And I've done both. I'm currently on an insulin pump. So I did many years with multiple daily injections and that. For me, that, because I was on such a small dose of insulin, it was really hard to finesse how much insulin I actually needed per meal. And then
Oh.
plus with all the carb counting, it was just getting, because we count in sort of insulin to carb ratio. So that means you might have 1 unit of insulin for 15 grams of carbs. So 15 grams of carbs is like, a slice of bread. So if I have one slice of bread, I might have 1 unit of insulin. And people don't realize that that changes throughout the time of day, throughout different things. And once we got down to, changing carb ratios to 1 to 8, I'm just like, I just can't count one. Like, my 8 multiplication tables, not the best thing in the world when I've got this delicious food in front of me. So it was tricky in that stage, in that sense. And there was also, for me, I felt it was a little bit restrictive because I'm a snacker. So I love having snacks throughout the day. I tend to go for, spontaneous exercise. So I don't really plan my day very well, even though I probably should. So it's quite difficult to manage that, particularly with exercise and sports and things like that. So for me, I felt that the injections they were great for a while. They worked perfectly. But if I had the option to go on an insulin pump, I wanted to take that. And for me, the pump was a lot more expensive because it's only subsidized through private health insurance. And I understand not everyone can afford that. So I'm really lucky in that sense. For someone with type 1 diabetes, the insulin pump consumables, like the lines and the things that you change every 3 days, they get subsidized by the NDSS. But that also still incurs a cost. Whereas with your injections, with the pen tips and your syringes, they're provided free of charge. So there's that cost factor there as well. But for me, the convenience factor far outweighed that cost benefit. It was so much easier to manage my life and live my life around diabetes as opposed to letting diabetes dictate what I did from hour to hour, using an insulin pump. And I found that so helpful in terms of, not forgetting to bring my insulin pens when I'm out. There have been a few times where I forgot my pump, but that's been very rare. But I tend to, with pens, they're sort of in a bag somewhere, and I might walk out and I forget something. So that's the biggest thing I hear from clients as well is, I always forget my pen. So
Yes.
for me, that was the thing to help me remember, because it's connected to me, pretty hard to forget. So that was really good. And it's really about personal choice when it comes down to. I've got friends that go back and forth, they might go on a pump holiday, if it's like a lot of my friends I see, particularly during summer, tend to go back on insulin injections because, when they're wearing like phases and things like that, they might prefer not to have something hanging out when they're at the beach. Pumps are expensive. So they range from like $8,000 to like $15,000. If someone knows what it is and they steal it or it's broken, it's it's not easy to replace.
It's another heartache, heartbreak rather. Full on. Oh my.
Exactly.
Okay.
Exactly. And it's an extra tool to sort of think about when you talk about insurances and stuff like that. So there's a lot of things to consider, but at the end of the day, there is no one thing's better for you than the other. I have, you can perfectly manage your diabetes really, really well on injections and pump. So it's completely up to you. And I know people who can't stand the pump, but people who love the pens, and then vice versa. So again, it's about personal choice.
Personal choice. Yeah, great. Perfect. Yeah. And now you mentioned about physical activity and exercises that when you go. So is playing sports or having an active lifestyle pretty common with type 1 diabetes, or is it just something that restrains us?
I think it's so important we have this conversation because people think that with type 1, there's so many things you can't do. But really, we can live our life, just the same as anyone else. It takes a lot more thinking, a lot more preparation, but you can get there. So for me, with exercise, it wasn't something that I was really fond of. I think particularly in my younger days, I was a swimmer. So that was all I kind of knew what to do. When I was diagnosed with diabetes, I ended up seeing because I was at uni at the time, and the uni had a exercise physio clinic where students needed to practice the skills, the kind of thing. So kind of like how dietetic students go on placement, you've got the same thing for the exercise physios. True. So I said, I'll join up, I'll learn how to do like gym work and exercise and things. And that was probably the biggest turning point for my life was learning how to do different exercises and gaining confidence to do that by myself at a gym with other people watching. That's so intimidating for me. And just gaining confidence to manage my diabetes with exercise in that controlled environment, and then taking that out to, the gym, doing classes, talking to people about diabetes. It started out, simple things like joining a class and then me going up to the instructor saying, hey, I have diabetes. If I stop halfway and check my sugars and have my, lollies and stuff, it's all okay. Like, I've got it under control. I will yell out if I need any help. So having the courage and the confidence to say that and to set things up for me, that was probably a really big thing. So
It's
for
huge.
me,
I can understand. That is
yeah.
so huge. Oh my God. I think that is
So
one factor of type 1 diabetes that is not understood really well. Even I think by families or something, the mental aspect of it. That's wonderful. Thank you for sharing that.
So thanks. So I think I often say that diabetes has really pulled me out of my shell a lot, because I was very much, an introvert. So talking to people and getting the confidence to advocate for myself was something I didn't really have. But, having diabetes really forced me out of that shell and really stand up for myself and say, actually, I deserve to be treated better than this. I deserve to get good health care and to be listened to and to live my life, essentially. So that whole thing came about, with those little baby steps of, go to the gym and things like that. So now I've sort of over the years stepped up that confidence and, doing boxing. I love sort of HIIT exercises. I love doing yoga. The sky's the limit. And I know people with type 1 who have climbed Mount Everest. I know people with type 1 who've done marathons and ultra marathons. And at the same time, I know people with type 1 who hate exercise. They might do dancing. They might do calisthenics. They might do, it's so individualized. It's so up to the person. But yeah, type 1 diabetes does not limit you. You have to do a lot of preparation beforehand, and it takes a lot of time to get to that stage where you're confident to do a lot of those things. But I feel like it's well worth the investment. So for me, exercise is very much a way to de-stress and to sort of refocus my day, essentially. And it's been really hard in this lockdown period where, you can't go to the gym, you can't use the weights. So the only thing I've got is sort of walking, which is weather dependent. Today is
Yes.
raining.
Oh. Like today in Melbourne, it's pretty chilly. I mean, I don't know whether it's raining at your end, but it's pouring mad like here, It's really...
It's been raining nonstop. Yeah.
Great. So, like we've talked about, one of the most important pillars for managing a healthy life, especially in diabetes, physical exercise and physical activity. Now, the next is nutritional education. How important, or what do you think is the role of nutritional education in managing type 1 diabetes?
I think that's key. I mean, with diabetes management, it's all about the food. A huge part of it's about the food and sort of what you eat. And this is, such a huge area to educate someone about, because you're not just educating them on, this is what a carbohydrate is, this is what it does to you. Something that we don't really talk about is developing and sort of teaching someone to have a healthy relationship with food. Because yes, you can talk to someone about carbohydrates and what impact that has on your blood sugars. And for me, when I first learned about that connection, I thought, easy, I'll just stop eating carbohydrates altogether. That way my sugars will be perfect. Little did I know that that's such a restrictive lifestyle of, restricting carbohydrates and ramping up the exercise 1,000% to try and manage my diabetes that way. Because that was the impression that I received from my doctors, was that if I did all these things right, I could reverse my diabetes. So that was that thought that they said to me. And I realized, down the track that's, encouraging very disordered eating behaviors here. So, over exercising, being overly restrictive and obsessive with food, those are red flags towards an eating disorder. And I didn't realize that until, reflecting on that way back now. So it's really important that when we start educating people around food, even if they don't have diabetes, just understanding that, hey, food is much more than nutrients in, nutrients out. It's about, enjoying your life. It's about enjoying food in a social manner. You go out, you have a meal with your friends, you have a few drinks. It's about balancing all of that and understanding, how are you going to balance that? And you can live your life in a perfectly healthy way. Like you could say, hey, we're going to have burgers for dinner, and then after dinner we're going to go for a nice walk, to try and get things going, and so you're not sitting down all the time. It's about maintaining that balance. If you
Very
want
true.
that donut, have that donut, enjoy that donut, and you find that the more you allow yourself to enjoy these things to a certain limit and not gorge on them or like binge on them, it satisfies your cravings. And then after a while, you just like, I'm going to have a bite of that, and that's fine. That will do me. The more you say no to yourself for something, the more you're going to want it. So we see this all the time. You say, okay, I'm not going to have any alcohol this month. And then all you can think about is, I can't have alcohol. I can't have alcohol. And that's all you want. And that's the same thing with like donuts and like people on diets are like, oh, I'm on this diet and I can't have this and I can't have that. The more you say no to yourself, the more it's just going to keep gnawing you, going, hey, look at this thing that you can't have that someone else is having. So it's about going, like learning to be in tune with your body and go, I really feel like chicken nuggets today. I'm going to, make a healthy alternative, or I'm going to get my chicken nuggets. I'm going to split it up with two different people. And that way I'm not eating the whole serve myself. There's lots of tactics and strategies around that. And it's really about striking that balance. Life is way too short to be counting carbs all the way to deathbed. So
very true. And I've seen a few patients with type 1 diabetes also, like, or even with type 2, they would be like, okay, I will eat a little bit more sugar. I will eat a little bit more sweets. I'll eat a little bit more of rice, and I'll put more insulin. I'll take more insulin. I'll take more medication. So this imbalance is also not good. Am I right? Like, I mean, they need to strike a right balance and to maintain these sugar levels and get a normal HbA1c after 3 months. What do you have to say about this?
So in terms of sort of, yes, if a person's on insulin, I can take as much insulin as I want to cover that. But again, it comes back down to that healthy relationship with food and striking that balance, as you said. It's about living that healthy lifestyle. So I could say, I have type 1 diabetes. I just use insulin to cover my food. I'll have an entire packet of Twisties, because that's what's in front of me right now, and that's like, 100 grams of carbohydrates. I'll just bolus for that. Sure, no problem. But is that necessarily good for me? No. So again, yes, it's about striking that healthy balance and understanding your foods. It's okay to have these foods once in a while, but you got to understand that it's, you want to be choosing like a good balance of things. You can't have too much of a bad thing or too much of a good thing too much. It's about enjoying life a little bit and knowing that it's also about your health at the end of the day. So yes, you can have your cakes, you can have your donuts, but have your vegetables as well. Have your lean meat. Like it's all relative to each other.
It's all
You
right.
want to
Truly
strike that
agree.
healthy balance. So yeah, you can have medication covering all the carbohydrates, but at the end of the day, it's about finding health for yourself.
Very well said. I think it's all about creating that balance and making the right healthy choices. And like, as dietitians, I think we always advocate it's not about diet. It's not about restrictive eating. It's more about the intuitive eating. And more importantly, it's all about understanding the basics of healthy eating. That's so important. So I think that's very well said. So now in the end, are there any tips and tricks or any suggestions that you would want to give to all of those who are suffering with, specifically with type 1 and especially with kids rather also, to avoid those hypos and hypers? Because I've seen it myself, when we're dealing with our little nephew, he's almost 15, but now also, sometimes his HbA1c has always been around 11ish mark, 9ish mark, like that. It's very difficult to manage those things. So any suggestions or any tips and tricks for him, for general people? Yeah.
I would say people with diabetes, you guys don't suffer from diabetes, you guys live with it. So if you keep thinking yourself as someone who's suffering from it, you got to use it as an excuse for stuff. So we don't suffer with diabetes, we live with it. We want to make diabetes oh, better not say that because that's rude. You want to you want to live with diabetes in a
That's
way where
huge. That's
it's
wonderful,
not
Ashley.
taking, it's not taking over your life. You need to live your life around, you need to make diabetes work for you as opposed to make
Mm.
you live, in the constraints of diabetes management. So for me, like, I always say that living with diabetes it's really annoying. Like, there's so much going on. There's, all these things you have to consider, you have to, pay for. And yes, they're really terrible days that you hate all the time. But at the same time, when I reflect on it on a broader prospect, it's given me so much more. It's really, really humbling, firstly, to see kids managing diabetes. Like, I used to help coordinate camps for children 4 to 8 years old. Seeing kids just charge on life and be like taking control of their diabetes, taking control of their insulin, their blood glucose testing, everything. It's so humbling to see that kids at that age being able to do all of that, and still live their life. They're still running around, they're still laughing, they're enjoying life, they're loving it. It's it's nice to see that sort of refreshing perspective as well. And it's really about trying to find that perspective, I think. Like, for me, I never used to do exercise apart from, once I finished swimming competitively, I was just like, whatever, I'm not doing it again. But now it's, I've come to realize I appreciate my body a lot more. I appreciate life a lot more. It's given me a different perspective on it. I feel healthier than before I was diagnosed with diabetes, because I'm exercising more. I'm more conscious of my food, of my body, of what my body needs, resting, being kind to myself, all of those things that people, could take for granted. Like, that's a big, big thing to become aware of, from a young age. So I'd say tips for anyone who's living with diabetes out there is to know that you're not alone in terms of living with this condition, and any stress that you might feel. If you feel like you're the only person in the world going through this, please reach out to someone. There's peer support groups out there, and that's something, we touched on a little bit in terms of mental health, but the mental health aspect of living with diabetes doesn't get touched on enough. And we know, National Diabetes Week, there was a whole thing on mental health, and it just highlights that you really need that holistic point of view when you're dealing with this condition. So it's really important that we do tackle that from a holistic point of view, looking after yourself physically, but also mentally. So reach out, peer support, talk to someone, talk to your family members, jump online, find people you can connect with, that you can talk to. There's so many resources out there. But don't ever feel like you're alone, and know that you can do it, even if it's just taking baby steps to get to where you need to be and where you want to be.
Perfect. Thank you so much, Ashley. I think that was a very wonderful note. I've written that down. You do not suffer with diabetes, you live with diabetes. I think this is huge. This is very, very positive, I think. And on this positive note, I would like to thank